The situation is dire at yet another long-term care home in Barrie, where more than 60 residents have tested positive with COVID-19. All hands are on deck to get the outbreak under control at Roberta Place. One long-term care home advocate says the help has arrived too late yet again.
Why does it always have to be that a whistleblower leaks how devastating and quote unquote apocalyptic the situation was in this home before we actually send help?
Currently, there are 63 residents and 53 staff who have tested positive for COVID-19. 9 residents have died. The outbreak was declared back on January 8th. The Simcoe Muskoka District Health Unit has issued an order for the temporary leadership of the home. The Canadian Red Cross, the Aurelia Soldiers Memorial Hospital, as well as a number of other agencies are assisting in an effort to get the outbreak under control. Barrie Dr. Kelly Wright is one of the few volunteers helping out in the home.
They were our patients. They weren't just numbers. We had a relationship with families. So, nobody can take the time to grieve as other homes, I'm sure, are facing the same challenges.
As of today, all residents and staff have been tested for the coronavirus. Testing is also underway to determine if the UK variant strain is part of this deadly outbreak. Dr. Wright says the province needs to step in, adding it's difficult to manage outbreaks like this one on a local level. The doctor suggests dispatching a military-like team to whichever home is dealing with the deadly spread.
If you could get a team of people that could come in and help take care of those logistical things, as well as provide staffing, at the ready, on demand, if possible. Folks who are ready to go, who've had both their vaccines, for example, with the skill set that we know is needed in long-term care.
The team would be helpful at a time 248 long-term care homes out of 626 in the province are dealing with an outbreak. 3,150 residents and 10 staff members have died so far. Dr. Vivian Stamatopoulos says the Minister of Long-Term Care needs to learn from what happened here, something that's already been seen in multiple homes before.
She should be holding an investigation into this home to find out what exactly went wrong, because every time there is one of these exploding outbreaks, and we have individuals who go in and do an investigation, we find time and time again that it's a series of preventable mistakes.
Stamatopoulos says vaccines should be given out urgently to all long-term care homes, not just the ones in hotspots, but adds this isn't the only solution.
These homes are still going to need to safeguard their residents for at least the next few months while the rest of the population even begins to see vaccination. So we cannot just assume that a vaccination is going to be the fix-all.
71 residents and a number of staff who didn't have COVID were vaccinated this past Saturday. Dr. Kelly Wright says she wishes the vaccinations would have arrived a few days sooner. For City News, I'm Maleeha Sheikh.